Today I would like to talk about cholera. It's a very important disease, either from microbiology or preventive medicine. You will get some questions from cholera. So you should know microbiology, pathology, physiology, and preventive medicine of cholera. So that's what we are going to cover in today's session. We are going to see what you should learn about cholera. At the end, you are going to do some MCQs. So download the file so that you can also do MCQs with me. And the entire notes is available as the download. So follow the download link and download this entire exercise. So let us see some important things about cholera. So what is cholera? In one point, super point. What is super point about cholera? It is an acute toxin-mediated diarrheal disease transmitted by fecal-oral route, characterized by rapid dehydration, but is highly preventable and controllable through prompt oral rehydration therapy, safe sanitation, water, hygiene, surveillance, and oral cholera vaccination. So here, the most important thing is oral rehydration therapy. That is what saves lives when they are affected by cholera. So cholera is an acute diarrheal disease caused by toxigenic Vibrio cholera serogroups 01 and 0139, and the vaccines they are made for these serogroups 01 and 0139. So it is characterized by the sudden onset of profuse, painless rice water diarrhea. That's important. Rice water diarrhea itself is a very good clue to cholera. And you see vomiting, rapid dehydration, which may lead to hypovolemic shock and death if untreated. The disease spreads primarily by the fecal-oral route through contaminated water and food and is closely associated with poor sanitation, unsafe drinking water, overcrowding, and natural disasters. So from public health and preventive medicine perspective, cholera is a waterborne epidemic disease. In states like Andhra Pradesh, 20 or 30 people die when cholera impacts like an epidemic in a district or two. So it's still killing people in Andhra Pradesh, Telangana, Karnataka, Maharashtra, Orissa, Chhattisgarh. These states are heavily affected by cholera. So it's an important indicator of deficiencies in water, sanitation, and hygiene. So whenever you see people affected by cholera, you can say they have poor hygiene, they have poor sanitation. Right, prompt oral rehydration therapy, surveillance, safe water, sanitation, health education, oral cholera vaccination remain the cornerstones of cholera prevention and control. So what should you learn? First of all, learn what is cholera, define cholera, what is the causative organism, what are the main serogroups. Then learn epidemiology, public health importance. Then learn about epidemiological determinants like age and host, environmental factors. Then we are going to discuss reservoir. Humans are the only reservoirs. All right, that's important to understand. Humans are the only reservoirs. The source incubation period can go from a few hours to days. Mode of transmission is fecal-oral. All right, fecal-oral transmission. And carriers of cholera. Describe the pathogenesis and clinical features. Interpret laboratory methods. Outline principles of case management, including ORT, IV fluids, antibiotics, outbreak investigation, preventive and control measures, and how to apply these high yield facts when you going to MBBS exam or NEET-PG or UNISET, FMG or USMLA. They all focus on these same things, one or the other. So you should have a good grip. So let us go through high yield notes. Okay, cholera is caused by toxigenic Vibrio cholerae. Epidemic cholera is caused by serogroup 0139, and LTAR biotype is responsible for most current epidemics worldwide and in India. So in India we have LTAR biotype, that is the important thing. So organism is gram-negative, comma-shaped, motile bacillus with a single polar flagellum. Cholera toxin is an enterotoxin. All right. So that is the virulence factor. It's just on this exotoxin, cyclic AMP is initiated, and the whole thing starts. Cholera occurs as both endemic and epidemic disease. That's important. It's both endemic and epidemic. It will stay under that epidemic level, dormant in a region. Okay, it causes endemics, and sometimes it can blow off and cause epidemics. It is strongly associated with poor sanitation, unsafe drinking water, overcrowding, floods, refugee camps. The disease is an important indicator of social and environmental development. Outbreaks are common following natural disasters, humanitarian crises. Epidemiological determinants, agent factors, as I said, Vibrio cholera 010139, LTAR biotype, cholera enterotoxin, and it is non-invasive. All right. So even in the intestine, if you see the intestinal epithelium, so this is non-invasive. The bacteria is not invading the intestine epithelium. Okay, it's only sending that toxin. The toxin causes all the damage. The host factors, all age groups are susceptible. Children are commonly affected. Okay, they also will have because they have low physiological reserves. They are also impacted very quickly, and mortality rate is also high in children. So reduced gastric acidity increases susceptibility, poor nutritional status, low socioeconomic conditions increases risk. Then environmental factors, contaminated drinking water is a major vehicle, poor sanitation, inadequate sewage disposal facilitate transmission, overcrowding and poor hygiene favor outbreaks. Then reservoir and source of infection. As I said, humans are the only known, all right? Humans are the only known reservoirs. Sources include clinical cases, mild cases, asymptomatic carriers. And we have 4 carrier types: incubatory, convalescent, contact, and chronic carriers. Mode of transmission, as I said, it is fecal oral route. Major vehicles include contaminated water, contaminated food, food handled by infected persons. Direct transmission occur through contaminated hands, and fomites may occur. Flies may mechanically contaminate food. Incubation period is 1 to 2 days, but it can range from a few hours to 5 days. Pathogenesis, Vibrios colonize the small intestine. The toxin activates adenylate cyclase, increases intracellular cyclic AMP, and that results in massive secretion of chloride and water. So the organism does not invade the intestinal mucosa, but it causes rapid loss of water and electrolytes. So clinical features, this is a very characteristic word, all right? Profuse rice water stools. Vomiting without nausea is common. Rapid dehydration and muscle cramps occur. Severe cases develop sunken eyes, weak pulse, hypotension, oliguria, shock. Death results from untreated dehydration and electrolyte imbalance. Laboratory diagnosis is also important. So you take fresh stool specimen, dark field examination, helps you because you see those motile bacteria. So that gives you a clue. Comma shaped motile bacteria in dark field microscopy. So you know the diagnosis. Enrichment medium is alkaline peptone water. Selective media include bile salt agar and TCBS agar. Stereotyping identifies 01, 139 strains. Alright, next, treatment oral rehydration therapy is the cornerstone of management. Severe dehydration requires Ringer's lactate. Alright, Ringer's lactate. If you don't have it, you can give normal saline, but normal saline does not help to correct acidosis. Alright, these people are acidotic. They are dehydrated and acidotic. So you have to give them Ringer's lactate to correct both dehydration and acidosis. Antibiotics shorten illness, all right, but never replace rehydration. So antibiotics, they shorten illness, but antibiotics is not the main thing. You always go for hydration. Zinc supplementation is recommended in children with acute diarrhea. So that's another important point. Zinc supplementation. Prevention and control, early case detection and notification, safe drinking water, proper sewage disposal, food hygiene, hand washing, health education, epidemiological surveillance, oral cholera vaccines, rapid outbreak investigation. Oral cholera vaccines, so we have like 3 vaccines: Dockerol, Sancol and Uvicol. Okay, so Sancol and Uvicol, they are against 0139, and Dockerol is like a recombinant, alright, is a recombinant toxin mediated vaccine. So that is Dockerol. Sancol and Uvicol, they are the wholesale against 01 and 0139. So some numbers from the master the numbers table. So we have 2 serotypes, okay, 01 and 0139. We have 2 major biotypes, classical and LTAR. In India, LTAR is the most common one. Incubation period 1 to 2 days. The range is few hours to 5 days. There are 4 types of cholera carriers: incubatory, convalescent, contact and chronic. There are 3 clinical stages of cholera: evacuation, collapse and recovery. There are 3 different WHO pre-qualified oral cholera vaccines: Dockerol, Sancol and Uvicol. And Sancol and Uvicol, you give 2 doses. Dockerol, for persons over 6 years, you give 2 doses. And for children 2 to 6 years, you give 3 doses. And the minimal interval between the doses is 7 days. And the maximum interval is 6 weeks. And the duration of protection for Dockerol is 2 years. And Sancol, the duration of protection is 3 years. And the target reduction in cholera deaths under global roadmap by 2030, 90%. All right. So WHO target year to end cholera as a public health threat is 2030. All right, folks. So these numbers are important. Any of these numbers can come as MCQs in your exam. So remember these numbers. They help you to understand and also to get your answers right. So now let us do some MCQs with that background. Okay, go through these high yield notes, because high yield notes help you to answer these MCQs. A 24-year-old man presents with sudden onset of profuse rice water stools after drinking contaminated water during a flood. The most likely or causative organism is, should be easy, right? There is the rice water stool. That's enough to answer. So this is B, Vibrio cholera 01. Which biotype of Vibrio cholera is responsible for the majority of cholera cases in India today? As I said, this is C, LTAR biotype. Okay. A patient develops profuse watery diarrhea without fever. Which toxin is directly responsible? So, a watery diarrhea, so we have to say that is cholera enterotoxin. Principal mechanism of diarrhea in cholera is, so I said these enterotoxin, it increases cyclic AMP mediated chloride secretion. So the correct answer is B. A microbiologist identifies an organism that does not invade the intestinal mucosa but produces severe watery diarrhea. Which disease is most likely? So it is not invading, okay? So this is cholera. Answer is A. The most important reservoir of cholera infection is, there is only one reservoir, that's humans. So the answer is C. The most important mode of transmission of cholera is fecal oral transmission. D. The usual incubation period of cholera is, so 1 to 2 days. Correct answer is C. Which stool appearance is classically associated with cholera? Rice water stool. The answer is B. The most important cause of death in cholera is, so the most important cause, they're losing, all right, rice water stools, a lot profuse water diarrhea. That itself helps you. So they're getting dehydrated. So severe dehydration is the correct answer. Investigation most suitable for rapid bedside presumptive diagnosis. So rapid bedside, it is dark field microscopy. You can see the comma-shaped Vibrio cholerae motile, all right, because of their flagellated ends. Which enrichment medium is commonly used before culturing Vibrio cholerae? Alkaline peptone water. The answer is B. A district medical officer is managing a cholera outbreak. What is the cornerstone of treatment? All right. The cornerstone of treatment in cholera is always oral rehydration therapy. All right. If patient cannot drink, then you do IV. All right. So either way, oral or intravenously, you are rehydrating. Then the preferred intravenous fluid for severe dehydration due to cholera is Ringer's lactate. As I told you, Ringer's lactate, it helps you to treat both dehydration and acidosis, whereas normal saline cannot help you. It's not a good source of potassium. These patients also have potassium loss. Normal saline does not help with potassium loss, but Ringer's lactate is a good source of potassium, and it also corrects acidemia. Antibiotics in cholera are primarily administered to, so they are primarily administered to shorten illness and reduce bacterial shedding. C. During a cholera outbreak, the first public health actions should be, so cholera outbreak is going, what is the first, first public health action is verify diagnosis. All right, that is true for everything. Always verify the diagnosis before you say we have cholera. First verify the diagnosis. Which environmental intervention has the greatest impact on preventing cholera? So to prevent cholera, supply safe drinking water and sanitation. The correct answer is B. Which cholera vaccine contains recombinant cholera toxin B subunit? Okay, so the correct answer here is Dockerol. All right, Dockerol is the correct answer because it has the recombinant cholera toxin B subunit. Which oral cholera vaccines provide protection against both 01 and 0139 serotypes? Here it is Shankal, all right, Shankal and MOR-CV-AX. Global road camp to end cholera aims to reduce cholera deaths by 90%. Correct answer is D. Which oral cholera vaccine contains recombinant cholera toxin B? All right, we already said that is Dockerol. And then a public health officer is planning an oral cholera vaccination campaign in endemic area. Which vaccine provides protection against both Vibrio color 01 and 0139. All right, so if you need both of them covered, it is Shankar. Doctoral primary immunization for individuals aged more than 6 years. All right, so more than 6 years, you just need 2 doses. All right, less than 6 years, 3 doses. So more than 6 years, 2 doses. So the correct answer is B. Which statements regarding UV is correct? UV it has characteristics similar to Shankal and is a WHO pre-qualified oral cholera vaccine. Which of the following statements about oral cholera vaccinations is correct? All right. So the correct answer here is C, because they are adjunct to water, sanitation, and hygiene measures for cholera prevention. So those basic things like good hygiene, good sanitation, good sewage disposal, pure water supply, those are the foundations to prevent cholera. Okay, vaccines and antibiotics, they are all secondary. So those are the most important things about cholera, and these points we shared today help you to answer questions, whether they come from microbiology or pathophysiology, medicine, preventive medicine. We covered everything. So go through these things. Visit us at Superpoints.ai. We have 4,000 questions. Exam grade 4,000 questions for USMLE, NEET-PG and other exams. So visit us, and I hope you got something out of this, and I will see you in next episode.